Actually, patient safety is a growing concern globally because a scientific advancement in medicine has improved health outcomes, but has put patient safety at risk. Medication errors and adverse reactions are the important risks that are being faced by the patients, which requires to take several or adopt several strategies in order to reduce the incidence of medication errors, including the strategy of developing patient safety as a specialized discipline in the curriculum of healthcare professions. And this is required to build patient safety knowledge, skills, and behavior among the healthcare professionals in order to minimize the incidence of medication error. The World Health Organization has also introduced an inclusive patient safety curriculum, which has been the components of which have been incorporated to the curriculum of medical and pharmacy professions in several countries in the world. As far as Pakistan, pharmacy education in Pakistan is concerned, the pharmacy education is offered here as a five-year Form D degree program. And here we have adopted a curriculum which was designed jointly by our council and the Higher Education Commission of Pakistan in 2013. Clinical pharmacy is a relatively new but an important dimension of pharmacy education in Pakistan, which necessitates introducing the emerging patient safety topics in the curriculum, because the curriculum is not having sufficient number of patient safety topic or sufficient patient safety training. However, for us, it is challenging to modify the pharmacy curriculum because the curriculum is having multiple dimensions and it is a heavy curriculum. So in the presence of such a curriculum, it was necessary to identify the important and urgent educational needs and to prioritize the areas of learning to introduce and implement necessary changes in the curriculum of Form D. So the purpose of this study was actually to assess the baseline culture of pharmacy students and to identify the areas requiring attention to tailor the required courses or training programs on patient safety in order to fulfill the educational needs to provide patient care training to the pharmacists so that they could work as an efficient or effective member of a healthcare team. In this study, the method we followed include a cross-sectional survey, which was conducted in two universities that are offering the Form D program. And in this study, we included final year students because the final year students have studied most of the pharmacy practice related courses and they have had exposure of working in a clinical or hospital setting, so they could better answer the question asked in this survey. And we use a validated survey tool that was originally developed by Professor Medgoski and validated by Walpola. And for this, we are very thankful to Professor Medgoski to let us use the validated survey tool, which helped us identifying the students' need. The first portion of the questionnaire included socio-demographic information of the participants, like their age and their gender. And the second portion included 24 close-ended questions that were related to the patient safety. And the responses of the participants were recorded on a 5-point Likert scale. As I already told, the data was collected from Form D final year students of two private sector universities of Islamabad, and the responses were recorded anonymously. And then on this, the raw data was organized and the stats was applied through statistical package for social sciences, which included descriptive statistics like frequencies and percentages were calculated, and the relationships between the overall patient safety attitude of pharmacists and their socio-demographic characteristics was found using Pearson chi-square test. The ethical approval was taken from the respected heads and deans of the universities. Students' participation was voluntary, and the written informed consent was obtained from the participants. The participants were also assured confidentiality and anonymity of the data. Here are the results of this study. This is the table about demographics of the students who participated in this study. A total of 160 students responded to the questionnaire. Most of them were female because majorly the females were enrolled in the two institutes where we got the data from. And they were in the age range of 20 to 27 years. And this is the 21 item questionnaire, which was answered by the students in order to assess their attitude towards the patient safety. Analysis of the result of this study show that around 63.7% or the majority of the students agreed with the fact that competent healthcare professionals do not make errors that lead to patient harm. So they actually acknowledge that competency is a key factor to avoid the happening of medication errors. However, there is here we see a misconception on the part of the students, which is needed to be tackled through their education or training, and let them know about the importance of human component, or to know that to err is human as an underlying cause of medical errors, because there are the elements like miscommunication, multitasking, tiredness, and fatigue during the work that can result in the medical errors despite of having competency. And this thing necessitates the development of a multidisciplinary system to monitor the medical care and avoid accidental errors to the patients. This misconception of the student is consistent with the responses they gave to the question number 10 and question number 11, which state that effective responses to errors in the delivery of healthcare focuses primarily on the healthcare professional involved, and that disciplinary action against an individual who made an error is an effective method of preventing future errors. So we can say that the disciplinary action may not be as effective um, because of infallibility of the human beings, and that it is needed to take multidisciplinary action and establish a monitoring system for the medical care to avoid the incidence of medical errors. Now, responding to the question number 2, nearly all the participants accepted that pharmacists should routinely spend part of their professional time working to improve patient care. This means that students value spending time to work to improve patient safety, and they consider this a significant thing to be adopted in order to ensure the patient safety. Now, to improve patient safety, it is necessary to find the cause of a medication error. And responding to the question number 3, which states that only medical practitioners can determine the cause of a medical error. As we can see that majority of the patients are agreed with this statement, and this reflects a fundamental misconception present among a large number of the students. Sorry, 50% of the students, or around half of the students. And this is their belief that only medical practitioners can determine the cause of medication errors. This finding is consistent with other studies conducted on medical students previously, that have shown that a significant number of students believe that only physicians can determine the cause of medication error. In contrast, a majority of the pharmacy students in a study conducted in Kingdom of Saudi Arabia did not agree with this view. This is because as medical services to the patients are provided through transdisciplinary system, the appropriate management of a medical incidence requires involving all healthcare professionals, hospital management, and the patient to analyze the root causes and implement systemic measures at all levels to address causative factors and prevent future recurrences of the incidents. The majority, that is 76.3% of the students, agreed with the item that the culture of pharmacy workplace makes it easy for pharmacy staff to deal constructively with errors. So it is true that the culture of a workplace matters, because a culture makes it easy for the right thing to perform and the wrong things to avoid. 95% of the students, the study participants, agreed that learning how to improve patient safety is an appropriate use of time in pharmacy program at university. This reflects that students value or consider it important to incorporate patient safety related courses to pharmacy education. The students' majority also affirmed that healthcare professionals, including pharmacy staff, routinely share information about errors and what caused them. So during their clinical training, they are routinely being informed by the pharmacy staff and other healthcare professions about or they are informed, or they are given the training about the errors and the causes of the errors during their clinical rotations in the hospitals or the clinic. And they also acknowledge that faculty and staff at the university or at in a clinical setup communicate to them that patient safety is high priority. So reporting, as we know, that is reporting is a crucial step towards the appropriate management of a medical incidence. Analysis by the previous studies have shown that disclosing medication errors to patients or their families is a challenging task. It was, however, encouraging for us to see that the vast majority of the students, around 88%, support reporting of the medication errors. 75% of the students sorry 87% of the students agreed that they should report errors to an affected patient and their families if harm to the patients has occurred. And similarly, the majority of the students also agreed that the pharmacist should discuss and report errors to an affected patient and their family, even if the patient is not harmed. And consistent with these two questions, the students also agreed. There are a few other questions which are through which the same thing is asked, but in a different way as the internal consistency check, like the question number 12, question number 13 and 14. These questions and the students' response to these questions also reflect that students believe that medication errors should be reported to the patients or their family or the hospital administration, and they should not keep it to themselves, even whether or not the harm has been caused. Now, responding to the question number 15, The students, 42.5% of the students agreed that most errors are due to things that healthcare professionals cannot do anything about. This agreement is in line with the study conducted in several other countries, including Iran as well as in New York. A number of previous studies have analyzed that most of the time medical professionals are unable to identify or recognize the problem of patient. Although medication errors are inevitable at times, a careful analysis of an incident to find out the cause and seriousness of the event can, however, help to reduce their frequency. So this is the misconception on the part of the student, because even if they are inevitable, they should be carefully analyzed in order to avoid their happening in future. So this is actually the question which needs to train students in order to change their attitude in the perspective of this particular item. Majority responding to the question number or item number 16, majority of the students believe that after an error occurs, an effective strategy is to work hard to be more careful. However, as we know, that human infallibility is inevitable and a major contributing factor towards adverse events. In addition, a significant number of errors may occur due to the reasons other than carelessness of the healthcare professionals. So I believe that the strategy of being careful enough to work hard may not work. And this actually needs a multidisciplinary approach which is needed to be adopted, and a monitoring system in order to help healthcare professionals to avoid occurrence of medication errors. And simply the work hard and being more careful may not work, because the to err is human, and this thing should be realized by the students, and we should make them train in such a way that they accept that besides hard work and besides more careful, additional strategies are needed to be adopted in order to make the patient free of any such accidental errors. The students also acknowledge that the care we provide on day-to-day basis can be improved. And that is, they are able to see that a room for improvement is there, and the current system, healthcare system, needs certain changes in order to provide the patients a healthcare which is with less number of or reduced number of medical errors. And they also, responding to the question number 18, most of the students also had a positive perception towards the acceptability of questioning the actions of their seniors and the significance of the culture of workplace in relation to patient safety. The majority of the students endorse that an internee pharmacist can question the action of the registered pharmacist in a healthcare setting, and it is also acceptable for a registered pharmacist to question the decisions of a prescriber. So this reflects the positive attitude on the part of the students, that they realize and they know that the questioning the decisions of a registered pharmacist or a prescriber regarding the medication or medication prescription or medication error is acceptable in our culture. Responding to the question number 20, most of the participants believe that patient safety education requires university lectures to teach patient safety concepts. The finding of this study endorsed that, the finding of this particular item endorsed that the pharmacy students realize the need to introduce patient safety related topics to the pharmacy curriculum. And This finding has also been reflected by the studies conducted in other countries, in other educational institutes abroad. So we recommend to include patient safety courses in the curriculum of pharmacy in Pakistan. Similarly, up to 90% of the participants also agreed that peer-led education, such as from pharmacist colleagues or fellow students, can help their understanding of patient safety concepts. A previous interventional study conducted at the University of Sydney has proved that involving trained pharmacy students in teaching introductory patient safety topics, including teamwork, communication skills, and it actually is helpful in improving the junior pharmacy students' attitude towards patient safety. This busy table is about.
Samaya, you have 2 minutes more.
Okay, fine, ma'am. So we didn't see actually any relationship or any difference between the gender of the students and their response. Male and female students both responded similarly to the questions that we asked. So based on the finding of this study, here are the conclusion. Here's the conclusion and the recommendations. The present study is an important step towards introducing patient safety education in the undergraduate pharmacy program in Pakistan. Overall, our pharmacy students showed a positive attitude towards the patient safety, and they also acknowledged that a good work environment is essential to avoiding the medication error done by the pharmacy students. However, there is a lack of awareness among the students about multifactorial mechanisms underlying the occurrence of medication errors and the importance of multidisciplinary approaches for their effective management. In this regard, introducing effective training program or courses tailored to improve the perceptions and fulfill educational needs of pharmacy students is essential. We also recommend to devise and implement better policies for patient safety. These steps will eventually reduce the incidence of all type of medication errors in hospitals and the clinical practice in Pakistan and abroad. We would like to acknowledge Dr. Wendy Medigoski, Director, Interprofessional Education and Development course, who allowed us to use her validated questionnaire for this study. Thank you.